Okay, we're going to take a look now at B syndrome. So we can kind of think of the first bit we talked about in terms of pain as being one section, and now we're talking about B syndromes. B syndromes pretty much are how we characterize or describe pain from a exclusively TCM perspective. So you could actually take all of this stuff about B syndromes and you can say, I'm not sure I need to know this because I can already look at it from other perspectives. If you want to use sort of full TCM names, it's useful to know that we call a lot of particularly the obstructive patterns, we call them B syndromes, and there are different things that we do for different types of pain. It's another way of characterizing pain conditions that we see all the time in practice, of course, from a TCM perspective. So let's take a look at some of the ways to understand B syndrome. There are four main types, but before we even get into that, these really all describe pain conditions characterized by obstruction. And we talked about deficiency patterns and how those can also lead to obstructions. Sometimes it actually is a little less clear than we want, but we've got four main types, and really we could say most of the conditions of pain that we see we can class as some of these. The most common causes of B syndrome are exactly the same as what we saw above, same as the causes of pain. Qi stagnation, blood stasis, cold, pretty much anything that creates a blood stasis or any kind of stasis will do that. Qi stagnation progresses to that. Cold or heat or damp heat will all give us some kind of stagnation or, again, a phlegm accumulation condition. Blood and or fluid deficiency, this one, of course, we talked about. This is we see often with that diffuse or deficient pattern pain. We'll see this particularly in our wandering B here, although wandering B can certainly be from excess as well. And we've got the same ones we saw above, deficiency of yang, qi, wei qi, anything that creates cold, of course creating stasis patterns pretty reliably. And then wind. Wind, again, if this one is a little tricky to understand, I do think, I pretty much say this every time I talk about wind, wind is a harder concept to grasp sometimes. If you're not quite there yet, don't worry about it. Let's talk about the differentiations of these, and like we saw in one of the previous videos, we're going to look at the tongues as we do so. Some of them will be the same overall image pictures that we brought up before, and then we'll highlight the tongues again. Really, as they say, the second 1,000 tongues are way easier to understand. The more times you look at a tongue, the more times you look at a tongue and try to understand all the different elements, the easier it gets to do it when you see it in practice. Wandering B, characterized by migrating, or as we would expect, wandering pain. This is more common than I thought it was going to be, and maybe some of you guys have seen this in practice, but I've had a lot of patients that come in and say, okay, well, tell me about the pain. Well, I've got a joint pain, but it seems to move around. Some days it's worse in my elbow, other days it's worse in my shoulder. The pain is usually achy, dull, chronic. It does occasionally have focal sharpness, and this is usually due to either an acute overuse or an injury or a particular stagnation or stasis in that area. But I would say the most common character is achy, dull, and it's a chronic pain and migrating. So for wandering B, you probably need to have a migrating pain. Almost always it's going to be achy and dull. Can affect any joint, but we see it most commonly in the shoulder, wrist, elbow, knee, and ankle. We don't see it as much in the hips, probably the only real joint that we're missing here. And then of course the neck and the spine. We don't really see wandering B so much there. Often will cause restriction of movement and pain on movement. So these are psychosomatic pain conditions. These really are pain on movement, and we do see restriction of movements. Often these are deficient. You've probably guessed that already based on the character of the pain. And if you glimpsed ahead to the tongue and the pulse, likely pale. Pulse might be slow or weak. This tells us that there's probably some cold pattern from a qi or a yang qi deficiency in this case. If we have an external invasion, it's kind of like wandering B is normally seen within these parameters, but usually external cold invasion can also give us a wandering B pattern, but that of course will be different, and that's usually in excess, and that'll give us a superficial pulse as well. So that's really where we see chills and fever in external invasions. Let's look at the tongue here. I think this is going to bring us up one we've already seen, but let's take a look at it again. So we're saying here it could be any color. Oh, there's our video from last time. But yeah, This is pretty characteristic. Expect to find some purple. I keep coming back to this one because I really like this as an example of, this is a deficient tongue, but that shows clear stagnation. So it's kind of like if we only looked at this area, we would see, yeah, that looks pretty pale. It gets pretty pale around here. We've probably got some liver blood deficiency happening out here. We can see that there's some cold creeping in because this coat is thicker and whiter. It's a little bit shiny on the edges, but that tells us, yeah, it's probably some kidney yang deficiency. We just definitely see purple in here. Pale tongue looks like this color all the way across. Obviously, we've got some light shining here. It looks like this all the way across. We also see some little dots here. Now that might tell us acute focal stagnation. That's the most likely cause, but we may not read too much into it. Most of what we want to see for stagnation is what we see in here. So this would be a pale tongue with some darkness. Expect to see that. That's a deficient tongue. May have a sticky coat. We saw that in that tongue as well. Usually that tells us cold is creeping in. The pulse, like it will be in all pain conditions, you'll see tight or tense. And then in this case, we've probably got weak or slow. And I'd actually say in clinical practice, this whole constellation comes up pretty reliably together. We have chronic, dull, achy, migrating pain with a pale, slightly purple tongue and a tense, weak pulse. The slow tells us things have progressed even further to the level of internal cold, which tells us that's a little more of concern. But the rest of this we do see pretty reliably as a pattern. Let's look now at painful B, or tong B, in contrast to B tong, which I'm sure you guys remember as an acupuncture point used for clearing dampness and congestion, particularly in the sinuses. B tong is a point. Tong B, or painful B, is characterized by localized, severe, stabbing pain. No redness or heat, though. This is almost exclusively a stasis pattern, almost exclusively caused by cold. So if you've got what is obviously stasis, but you do not see heat, then you've probably got a painful cold B pattern. Body may be pale, bluish, purple. We're going to take a look and we'll see what we can find. This, before we look at the tongue though, the pulse here will almost definitely be wiry. This is an excess condition. We've got excess internal cold. It is in quite contrast to the one above. The tongue might look pale and purple, similar to what we saw above, but we will feel a difference in the pulse, and most importantly, we'll see a difference in the character of pain. The pain will be severe, stabbing, and I like to describe it like this. When you say point to where it hurts, which is something I always do, they don't do a general round area. They say right here it hurts. Let's look at the tongue that we might see in a painful B presentation. So this one we already saw, and let's see what comes up here. So we're looking for something that has blue and purple there. I think when I looked at this, when I originally picked this, this was my best example we came up with. Let's see, didn't get a lot bigger there. So this one we do see, it doesn't look totally dissimilar from the one we looked at for a pale tongue, but we see more whiteness, and I think in here, we kind of see more of that bluish hue. Now we can't see the back of this tongue. I would expect it to be thicker white, but the white coat extends a little further. Kind of got more of these petechiae here. This doesn't suggest heat. It might even suggest cold stasis, but this looks like a cold pattern stagnation tongue. Let's see if we see any other examples as we scroll down. It's hard, but I find this a useful way to look at tongue. So this would be a very deficient tongue. Maybe some cold creeping in. This is definitely deficient and stagnant tongue. We see a very deep earth crack here. So that might suggest something. Other than that, I think it's funny, the further you go, the more weird stuff you start to get. But, like, why are there sneakers when I search tongue? I don't know. Oh, tongue rings there. Look at that. Gets crazy. So let's use the one that we already looked at as our best example, but expect to see a palish tongue that is bluish purple. You have to see this kind of dark purple, very much in contrast to a red purple that you see here. All right, that's our painful B. Fixed B, and of course we're going to get into heat B as well. Let's look at fixed B first. Characterized by local soreness, achiness, numbness, and heaviness, mainly caused by damp. Yes, correct. This is often the pain we see when we have dampness, usually in individuals that carry a significant amount of extra dampness. These are achy joints. We may not see the restriction of movement, but we do see pain, and I would say you have to hear the words sort of like heaviness or achiness. These are sore joints due to damp obstruction, usually of the collaterals. So what do we expect to feel in the pulse? Slippery. It might be soft, or sometimes we use the word soggy. These are all fairly characteristic of damp accumulation. Probably if we actually do have a fixed B pattern from dampness, we probably do have more than your sort of expected amount of dampness, so we may actually see a little more stickiness in general. We do definitely expect to see a swollen body, sticky white coat. Let's see what we've got for tongue examples here. See if this comes up. And we'll take a look at some tongues. The more tongues you see, the better. Yeah, look at that. So that is very clearly a swollen tongue. A lot of these are, whoa, look at that crazy tongue. I don't know what that is. But we've got lots of swollen tongues. This would almost definitely be a stroke patient, and this is about as much swelling as you get, but you see there's a clear differentiation from one side to the other. This suggests this is probably an inpatient as well. Here's a deviated tongue. This might be the same patient. That's a very swollen tongue, but that's a more advanced condition. Those are good examples of swollen tongue. There's a classic spleen chi deficiency swollen tongue. Let's see what else we can find here. These are all pretty swollen. The more swelling you, whoa, that's crazy. The more swelling you see, the more significant the dampness. There's actually a pretty good picture of a very swollen tongue. This one is swollen. I've got some other things happening here. That's an area of peeling, which tells us things are progressing in a couple other areas. But we see the teeth marks. We see this swollen, just kind of a nice side angle, because you can also see it's swollen top to bottom as well. That would be a swollen tongue. This probably is an older person. I'm guessing this exclusively based on the floral patterning that I see in the clothes here. This would probably be a good example of someone where we would expect to see some of a fixed B pattern. Probably the most common form of B syndrome that we see is in our heat B patterns, characterized by redness and swelling. When you actually think of joint pain and inflammation, that's heat B. Most of the time, a lot of the pain that comes into our offices actually is this. Characterized by redness and swelling. You can usually see this, you can usually feel this. We've got internal, sometimes external heat. There may be wind. We sometimes see this where the pain is rapid onset and quite painful. The pain in heat B is usually pretty significant. Inflammatory arthralgias, often involving one or multiple joints. This is starting to sound probably like rheumatoid arthritis, and that's probably our best example of a heat B pattern. Excruciating pain with restriction of movement. Yep. Alleviated by cold, aggravated by heat. Yes. And we haven't said here better with motion, but that is obviously characteristic of a lot of the rheumatoid patterns. We do often see that in heat B. We're generally pretty good at treating heat B or inflammatory conditions. Obviously, once degeneration has occurred, it's much easier. Sorry, that's not true at all. It's much more difficult to see relief because we have a condition that has taken substance. I've talked about that again and again with both OA and RA. One of the best things we do is we see this at the level of heat B. We're starting to get swollen, painful joints, but everything else on imaging looks normal. We don't see degeneration yet. That's where we do our most diligent work to prevent degeneration, because pain is much easier to treat at the chi level than it is to treat at the blood or substance level. Let's take a look at a red-bodied tongue with a yellow tongue coat. You will see this. The more significant the arthritic pattern, the more we've got sort of even a classic RA pattern, the more you'll see a truly red tongue, often with a notably yellow coat. Let's see what we can find here. That's a yellow coat for sure. That I'd actually expect to see. Oh, that's from our old friend Matt Chioccia there. Probably a lot of these pictures. There's another one from Matt Chioccia. He took a lot of pictures of tongues in his day, and we benefit from that. We see some heat here. Now this is, we've got enough yellow coat here. This is actually not a bad tongue to look at here. In the more significant the heat pattern, the more we'd expect this tongue to even be a beefier red. But we've definitely got heat in here, and we've got stagnation in here. And this is just yellow enough that I would say, okay, we can call this tongue yellow, but I'd be more inclined to call this area white. Now what this might suggest to us is that we have both some heat and some cold and some stagnation. And if it sounds like that's a lot in a tongue, it is, but it's not uncommon. If we think of who normally gets a lot of these conditions. It's often older people. And the older a person is, the more complex we can see patterns in their tongue. So this could be the tongue of someone who does have a Heat B syndrome. But I'd like to find a redder tongue to kind of show you what it looks like. I'm actually surprised I haven't seen that as much. What have we got up here in our search? Red tongue, yellow coat. Let's just try red tongue and see if that gives us some more redness. I've looked up a lot of, trying to find the best tongues I can. I've looked up quite a few. These are not well kids. That might even be artificial. Let's see. Well, there's a good example of a red tongue. There's a very, very red tongue. This is definitely a full heat presentation, but this would be something I think quite a bit more significant. There's a crazy example of cracks. Both of these would be serious heat conditions, ones that we don't see with the exception of either ongoing substance use, usually of the hot and the stimulants, medications, or quite advanced pathologies. I think this is why I didn't go with the red tongue, because I ended up with too much advanced pathology and not enough. That's getting a little closer here to a red tongue, but that still looks much more red than I would expect to see in arthritis. So we might have to settle for the redness we saw in the previous one. I'd like to find a good, because red tongues, we see them. We don't see them often, but we do see them, and I'm surprised we don't have a better example of a red tongue on here. It's kind of like everyone only takes pictures of the extreme versions, and most of these are quite extreme versions. When you see a red tongue, that's still not red. When you see a red tongue, you'll know. Look at that. We're down to looking at fish tongues now. Yeah, this is crazy, by the way. Like, there's a parasite that eats the fish's tongue, and it actually becomes the fish's tongue. It happens to cod. I know this because I lived on the East Coast, and that was a thing. All right, I'm not sure we're going to find a better example of a red tongue, no matter how long we scroll. And so we might have to just go with the one that we already saw and say, it was close to red enough. But expect to see red body and a yellow tongue coat. I would say red body is more characteristic than the yellow tongue coat, but I'd expect to see both. The pulse will definitely be rapid. In a Heat B presentation, the pulse will be rapid. It will usually be full, and we can call it tight or we can call it wiry, but this is a fairly characteristic pulse. If you've got someone with an active rheumatoid flare, which is a classic Heat B presentation, their pulse will be pretty reliably all of these things. You'll know it when you see it, and you probably won't mistake it for any of the other patterns. Heat B is usually pretty characteristic. All right, this next section is maybe disappointingly short, but it's because it's in relation to what we saw above in terms of treatment for pain. What we do for one form of pain like Heat B can be very different from the other types of pain where we see cold. If it's a pathogenic cold, we obviously do treat that much differently than we treat pathogenic heat or Heat B syndrome. So all of the things that we saw above, and if you're watching this video out of order, that's of course fine. You can go back to the previous video where you'll see demos of most of these if you want to get a little better feeling of how they work and how we use them. You'll have to determine what you do. The more stagnation, the more you use cupping. The more deficient and cold, the more you use moxa. If you really want to move a lot of blood, you might consider gua sha. If you want to work on a deeper level, you might use some tuina, so those are different massage or adjustment techniques. Electrode you could probably use in just about every pain condition, helps relieve pain. Here, you'll see this in our video here. It's actually not in the note pack. I added it because I just thought it would be nice for you guys to have. Here's some general points to treat pain. And right now, at this point, you might be sort of hungry for this. It's like, okay, give me a protocol to treat pain. But the longer you get into it, this really is the easiest part because you know your points more generally. The more important part is actually the differentiation, which is why we spend so much time on it. If you treat a Heat B like a cold pattern, you'll make it worse. If you treat a cold pattern like it's a heat pattern, you'll make it worse. So knowing what to do is best. However, all of these you could generally use. Li4, liver 3, these are our 4 gate points. These are great at relieving pain, opening, and releasing. You could add triple warmer 5 in here. That releases the exterior. That's sometimes useful. Li11, probably the most common point. We think of it mostly as a point for clearing heat, so it's more indicated if you've got heat. But in general, if you actually read about it, it's kind of indicated for any clearing and excess pattern. So we use this point pretty reliably in pain. Gallbladder 42 and 41, these are also useful, releasing tension in particular, where you've got a tense pain. Gallbladder 21 is a nice relaxing point. This is the one that's at the midpoint of the traps, and often you'll find a trigger point there, and if you do find a trigger point there, release that trigger point. Don't worry about the Chun location. Use this one based on the anatomical location, the highest point of the shoulder, and almost always where you find that knot in there. Ba Theng and Ba Shi I find very useful, especially when we need to clear heat or we need to clear wind. Yao Tong's Wei, these are actually kind of similar to Gallbladder 42, Li4, and Liver 3. A lot of that collection, that series of points, are very useful for releasing tension, releasing pain, and then of course governing vessel 20. This is the most yang of all the points. Pain is usually, I think I can say almost always, yang in nature. Well, no, I can't say that. There are definitely some times when it's yin in nature, so I'll take that back. But I'll say when you want to work with the yang, if you do, especially in a B condition, you may want to use governing vessel 20 to treat that. Okay, that's an overview of our B syndromes. We've kind of put those all together in one video, really just to look at them as B syndromes. Combine this with what we've already seen in terms of treating pain and some of the causes of pain. You're probably well on your way to understanding pain from a TCM perspective. Hope you enjoyed the video, and as I mentioned before, if you have comments, feel free to leave them and let me know. Thanks.